Imagine a blood clot, often forming deep within the legs, silently traveling through the bloodstream. This clot, now a pulmonary embolism, lodges in the lungs, obstructing blood flow. The results can be devastating, even fatal. Pulmonary embolisms are a serious medical condition often striking without warning. They affect thousands each year, highlighting the need for awareness and understanding. This essay will shed light on this silent killer, empowering you with knowledge about its causes, symptoms, and treatment. By understanding the intricacies of pulmonary embolisms, we can take proactive steps to mitigate risks and seek timely medical intervention when necessary. Knowledge is power, especially when it comes to our health. A pulmonary embolism, or PE, occurs when a blood clot, known as a thrombus, blocks an artery in the lungs. These clots typically originate in the deep veins of the legs or pelvis, a condition called deep vein thrombosis. When a clot breaks free, it travels through the bloodstream, reaching the heart and eventually lodging in the pulmonary arteries. These arteries are responsible for carrying oxygen-poor blood from the heart to the lungs for oxygenation. The blockage disrupts this vital process, depriving the body of oxygen and potentially damaging lung tissue. In severe cases, a PE can lead to heart failure or even death. While anyone can develop a pulmonary embolism, certain factors can significantly increase your risk. Understanding these factors is crucial in early detection and prevention. Prolonged immobility, such as during long flights or bed rest, can increase the risk of clot formation. Surgery, especially orthopedic procedures, also poses a higher risk. Other factors include a family history of blood clots, obesity, smoking, and certain medical conditions like cancer, heart failure, and stroke. Pregnancy and the postpartum period also increase the risk due to hormonal changes and increased pressure on veins. Additionally, individuals with inherited clotting disorders are at a higher risk of developing PE. Pulmonary embolism is often called a silent killer because its symptoms can be subtle and easily mistaken for other conditions. However, being aware of these symptoms is crucial for seeking timely medical attention. Shortness of breath is one of the most common symptoms, often coming on suddenly and worsening with activity. Chest pain is another red flag, often sharp and stabbing, and may worsen with deep breathing or coughing. Other symptoms include a rapid heartbeat, coughing up blood, dizziness or lightheadedness, and excessive sweating. If you experience any of these symptoms, especially if you have any risk factors, seek immediate medical attention. Section 5. Early diagnosis is key. Early diagnosis is vital for effective treatment of pulmonary embolism. Detecting the condition at an early stage can significantly improve the chances of successful treatment and recovery. If you experience any of the symptoms mentioned earlier, your doctor will conduct a thorough evaluation, including a physical exam and a review of your medical history. This initial assessment helps in identifying potential risk factors and symptoms that may indicate the presence of a pulmonary embolism. To confirm the diagnosis, imaging tests are crucial. These tests provide detailed insights into the condition of your lungs and help in pinpointing the exact location of any blockages. A CT pulmonary angiogram is the gold standard, providing detailed images of the pulmonary arteries to detect any blockages. This test is highly effective in visualizing the blood flow and identifying any obstructions. Other imaging tests include a VQ scan, which measures airflow and blood flow in the lungs. This test is particularly useful in cases where a CT scan may not be suitable. In addition to imaging, blood tests such as a D-dimer test may be ordered. These tests help in assessing the likelihood of a clot being present in the body. This test measures a substance released when a clot breaks down and can help rule out PE in some cases. By combining imaging and blood tests, doctors can make a more accurate diagnosis and develop an effective treatment plan. Section 6. Treatment options, a path to recovery. This section delves into the various treatment options available for those diagnosed with a pulmonary embolism, a condition that requires immediate medical attention. Once a pulmonary embolism is diagnosed, prompt treatment is essential to prevent life-threatening complications. The urgency of the situation cannot be overstated, as timely intervention can significantly improve outcomes. The primary goal of treatment is to prevent the clot from getting larger and to reduce the risk of further clots. This involves a combination of medications and, in some cases, surgical interventions. Blood thinners, also known as anticoagulants, are the cornerstone of treatment. These medications help to keep the blood flowing smoothly and prevent the formation of new clots. These medications, such as heparin or warfarin, prevent blood clots from growing and reduce the risk of new clots forming. They are often administered through injections or oral pills, depending on the patient's condition. In severe cases, clot-busting medications called thrombolytics may be administered to dissolve the clot quickly. These powerful drugs are used in emergency situations to restore normal blood flow. In some instances, surgical procedures, such as clot removal or the placement of a filter in the inferior vena cava, a large vein that carries blood from the lower body to the heart, may be necessary. These procedures are typically considered when other treatments are not effective or when the patient's condition is critical. Section 7. Prevention, your best defense. While pulmonary embolisms can be life-threatening, the good news is that many cases are preventable. Prevention is key, and understanding how to protect yourself is the first step. By making healthy lifestyle choices and being aware of risk factors, you can significantly reduce your chances of developing this condition. Regular exercise, such as jogging, walking, or even light stretching, can make a big difference. Staying active and avoiding prolonged periods of inactivity is crucial. Joining group exercise classes or working with a fitness trainer can help keep you motivated and on track. If you're traveling long distances, make sure to get up and move around every few hours. Simple stretches and short walks can help maintain good circulation. If you've had surgery, follow your doctor's recommendations for early ambulation. This can help prevent complications and promote faster recovery. Maintaining a healthy weight, quitting smoking, and staying hydrated are also essential. These lifestyle changes can have a profound impact on your overall health and well-being. If you have any risk factors, such as a family history of blood clots or a previous PE, talk to your doctor about preventative measures, such as compression stockings or medication. Regular checkups and open communication with your healthcare provider are vital. Section 8. The importance of immediate action. Pulmonary embolism is a serious condition, but with prompt diagnosis and treatment, most people can make a full recovery. Remember, time is of the essence. If you experience any of the symptoms mentioned earlier, don't hesitate to seek immediate medical attention. Early intervention can be life-saving. By understanding the risks, recognizing the symptoms, and seeking timely medical care, we can all play a role in preventing and treating this silent killer. Your health is your most valuable asset, so take charge and stay informed.